When I asked the organizers of this program, I said, if I gave you a magic wand and all the money in the world, what would you do to help the addiction crisis? And their answer was regulate fentanyl. For somebody who's worked in addiction and mental health as long as you have and seen the success that you have, how do you respond to that?
Well, first of all, there's no such thing as regulating fentanyl because fentanyl isn't even a drug to regulate. Fentanyl, what we're seeing on the street right now, is an illegal drug coming out of China that is not even requiring farmers' fields anymore of an opiate. And I'm not even sure why it's called fentanyl because it isn't coming off of the poppy plant. It is true chemicals, and somebody somewhere along the line coined it fentanyl. The only liquid fentanyl that you can get is in a hospital, mainly in an operating room. So you could never regulate something that doesn't exist. The only drug that does exist that's equivalent or not even equivalent to the chemical drugs that are on our streets right now, nothing that we produce can ever be that strong. What we used to call when I was a nurse is Dilaudid is now called hydromorphone, which is what is being used as a safe supply. Dilaudid was never produced to be injected. Dilaudid is a narcotic that you take by mouth, and when I was in nursing, you would get one pill every 6 hours. After probably an operation that wasn't just your toenails off. And so the drug that is currently being used as what one considers safe supply, people are injecting. There's fillers in hydromorphone, and that's why it isn't a pill to be injected. Well, most pills aren't pills to be injected. If you go back to when opiates started in Percocets and Percodan, they were so chalky you couldn't inject them. So we didn't have that problem back then. Back then it was heroin. And so now Dilaudids, when you get safe supply, if you're not selling them and you're using them, I think I don't work there, so I don't know what people are being told, but I know that there is research out there that's showing that those fillers or fibers or whatever that are in those pills are somehow in certain people being lodged in the spine, which is then causing a severe infection and people are dying. And so I think the problem with research is you have this group of people writing research that this is saving lives, and then you have people on this side that is producing research that is saying it's not saving lives. But I don't know where that research is. When I read something in the Globe or the Star or the Sun or wherever the paper is, and I, as somebody that is just in the process of completing my PhD, and I would consider myself a scholar in the area of addictions, I have written journalists in the past asking them, are these papers that you're referring to, and never get a call back. And so I'd like to know where these papers that people are citing are, so that us as research can tear it apart and question them.
Back to your focus on the solution, not the problem. And I asked this question to the 360, so I'm going to ask you. If I gave you all the money in the world, which, by the way, you've been shut out repeatedly by federal money, but if I gave you all the money in the world and a magic wand, what would you do?
Well, I'd create a center because the center is the most important thing to do, and have different modalities. So, it would be the Red Path Wellness Center. We would have outpatient for those that don't need high-end level addiction treatment. There would be also an addiction treatment residential beds, and then there would be transitional beds, because that is one of the biggest things, and that, you would have other sort of healers there as well. So, here we have Reiki, we have massage, we have Indigenous drummers, we have a variety of other things that can happen. We do journaling. So, somebody might go through our program more than once because they like to do that. And then you take them then and you teach them, okay, this has been the problem, let's journal it, and let's see how you're dealing with that right now.